Well, welcome everyone. I know we're just right at 1 o'clock and we're having, mostly an informal or guided discussion this afternoon. So we'll go ahead and just jump right in. My name is Courtney Pladsen. I am the clinical director at the National Healthcare for the Homeless Council, and we're really grateful to hold the space with you all today. It's been a lot. It's been a long pandemic. It's been a long year, a long political season. It's been an intense time for all of us in different ways. And so we just in the last few months at the council have just been hearing from folks on our committees, and as we're doing different work, just hearing how exhausted and overwhelmed and tired folks are. So we wanted to spend this month, the month of January, focusing on just trying to hold space for people, trying to connect with people across the country as we're doing this work, because it's unique. This work is unique and different. And so we really wanted to help people connect to others that are doing this work. And so the first webinar series was hosted by Catherine, and it's hosted on our website and talked about Mortality Toolkit. And it's a really wonderful conversation about loss and grief and some of the wonderful work that the policy committee has done around Mortality Toolkit. So please check that out, and we'll put a link in the chat about that as well, so you can go back and reference that. So today's part 2 about living through a pandemic and checking in about how we're all doing. And then next week, we have another webinar that we'll share about what we can do. And Matt Bennett will be joining us and presenting on that next week. So we will include links to these resources. I'm going to kick us off, just do a brief intro of the host today, and then I'll be mostly in the background. But it's my pleasure to introduce Caitlin and Lawanda. Caitlin is a medical respite manager here at the council. We're so grateful she joined the council recently from Baltimore, so we're really grateful to have her now on staff. She's an occupational therapist and brings a wealth of experience to our staff. And really grateful for Lawanda Williams to join us. She's on our Clinicians Network. She is the Chief Behavioral Health Officer from Healthcare for the Homeless in Baltimore. So really grateful for them both and what they can bring to this conversation today. Our coffee chat is in part sponsored through HRSA, and the contents of our conversation today do not necessarily represent the US government. So important to share that. So I am going to turn it over. I'm going to stop my screen, and I'm going to turn it over to Lawanda.
Hi, everybody. So grateful to be with you all this afternoon. My name is Lawanda Williams, and I am the Chief Behavioral Health Officer at Healthcare for the Homeless in Baltimore City. And just grateful to be with you all today, to be able to have the space to talk about how we've all been managing through the pandemic. A little bit of background about myself. I've been working with Healthcare for the Homeless for the last 10 years. More recently moved into a role as Chief Behavioral Health Officer in this past July. Prior to that, I served for about 5.5 years as our housing Director of Housing Services, where I sort of oversaw all of our permanent supportive housing programs. So very, very glad to be with you this afternoon.
Caitlin, do you want to introduce yourself?
Sure, yeah. So Courtney gave a pretty great introduction, but I'm Caitlin. As she said, I'm an occupational therapist, and for the last 5.5-ish years prior to coming to the council, I was actually working with Lawanda at the Baltimore Healthcare for the Homeless as an occupational therapist there. And I'm excited to have moved into this role at the National Council and sort of have both feet in the clinical world, but also in the larger programmatic development world. So, and very grateful that all of you are here today, and hopefully we can have a conversation just really to check in with everyone and think about how we're doing and the importance of doing that check-in with ourselves with everything that has been going on, as Courtney mentioned.
Lawanda, could you give us a brief overview of moral injury and explain that concept to us?
Yeah, I'd be happy to. So I should step back a moment and say that part of my sort of landing at this idea of moral injury had really been through my own search to sort of figure out why I was sort of experiencing and having some of the feelings that were coming up for me, particularly related to the pandemic. And as a licensed clinical social worker, I think one of the things that we sort of get pounded with and sort of indoctrinated with is this idea of, self-care and resilience and taking care of oneself. And, as I sort of traversed through the pandemic, really had come to this reckoning that none of those things were really working well for me. And really trying to figure out what was really happening that it better explained why this felt so heavy in ways that heavy things are not necessarily uncommon to me, but this felt very different. And so really wrestling with this idea of trying to figure out what that might be about, and really landed on this concept of moral injury. And really what it is that when there's something so core and central to who you are as an individual, that gets broken or ruptured in some way as a product of something that's going on externally. And really what it is that there's this discrepancy between how you're able to show up and how you're able to be, and how that conflicts with your values and your sense of conscience, right? And I can remember thinking about this most clearly around issues of food security. And really, as an organization, we had come to a point where we were not able to do home visits because of the pandemic. Things were very new. We were learning what was happening with COVID-19, and there were still a lot of things that we did not know. And so one of the things that we'd done, we'd stopped doing home visits such that we were not able to go out and meet this need for individuals. And so it really was this idea of that, reckoning with the idea that food is such a core thing for people, and not being able to meet that need, knowing that I was going home every day and being able to eat and do all the things that I'd been doing, really caused a sort of rupture for me that was sort of at the soul level. And so that's what really caused me to think more about this idea of moral injury, that this pandemic has really caused us to be at a place where there are things that are very inconsistent with how we normally show up, and what that does to us at a soul level. And so when you think about the pandemic and some of the things that you're going through, I'd encourage you to maybe think about whether that might be what you're experiencing. The things that we believe, the morals that sort of guide us through our day to day. As practitioners, we're very much accustomed to wanting to provide a high quality of service to individuals, and then having to go from the delivery of care that is high quality to delivery of care that's sort of grounded in crisis mode, and what you have to sacrifice as it relates to that and how that impacts people that we care deeply about, also can cause this sort of moral injury. So I just wanted to sort of posit that with you all as a way of sort of conceptualizing perhaps if you're having those kinds of feelings, to one, recognize that it is very normal. I like to always sort of start these conversations off with this idea that however you are feeling right now is okay. There's never been a time where we have all collectively had such a unifying experience. And when I say that, I think about it from the standpoint that, like, what I might be feeling in this very moment, in terms of the concerns about the pandemic, my health, my family, all of those things are the exact same thing that someone in the other corner of the world is experiencing, right? And I don't think we've ever had such a unifying experience. And so with that, what you're feeling can't be you. Like, you can't be wrong if someone all the way across the globe that you don't know could be feeling the exact same thing. So just to sort of normalize whatever it is that you feel in the day to day, knowing that those things change, just like the wind blows, right? So I'll leave it there. I want to turn it over to Caitlin to talk a little bit about some tools and some practical things that might be helpful in sort of weathering this space that we're in right now.
Great. Thank you, Lawanda, for that really great framing of that. And moral injury was a newer term to me, but I think a lot of us can relate to how well that encapsulates what we've been feeling in terms of, like, we know what's best, but we we know what's safe right now, and not having all of the answers to that, I think, has been really challenging for a lot of us in navigating this. So we're going to bring up a tool, and basically what we were trying to avoid in doing this coffee chat was to give a prescription of this is the best way to take care of yourself, or this is the best way to address some of these issues that are coming up, but really more of a tool to be able to just check in with yourself, recognizing really that, especially as providers in health centers, in whatever your role might be, that we don't always, clinicians and providers don't always have the option to turn off, right? There's not sort of a, oh, I'm just going to not check my email for a couple of hours because I need a break from that, right? That's part of our day-to-day in client care, is checking emails and messages, or thinking about, I think often thinking about your clients at the end of the day, or leaving a stressful work situation and coming into caring for family. Many folks are caregivers of some sort, or worrying about friends, and sort of that existential worry that's hanging over everything right now. And so really what this tool is to help identify where we are, because not every day is the same. Certain experiences can be lifting, and certain experiences can be really draining. And checking in with ourselves just sort of helps us know, where am I, and what is realistic to expect of myself at this time. So this might look familiar to a lot of clinicians. It's an adaptation of the pain scale, right? So 0 to 10, sort of that green is I'm good, I'm feeling good, things, there might be a little discomfort, like COVID is existing, but today, like, it's not weighing on me, versus those higher levels, 8, 9, or 10, where it's kind of, it's overwhelming me. It's all I can think about. I feel it in my body. I feel it in my stomach and my shoulders. I can't shake thoughts that I'm having in my head. Really overwhelming. And the idea behind this check-in tool is first to recognize, what are your signs of these different levels of stress and burnout? What tells you that you're feeling this particular way? Again, it could be physical symptoms. People start to get migraines and headaches, or shoulder tension is especially one a lot of people notice. And then also sort of the mental, right? Not being able to turn your brain off, or like I'm at home and I'm watching Netflix, which is supposed to be relaxing, and all I can think about is stressor A, B, and C. And so those are signs that things are more overwhelming or more encompassing of you. So noticing for yourself, what are the signs that I'm feeling that way? And then problem solving. And this is a good task to do more when you're in a better or a clearer space, but thinking about, what is it that I feel like I can do at this moment? Recognizing that even when I'm feeling at my most burnt out, it's probably not realistic for me to just like shut off or go somewhere in this space or unplug from everything. That's not always accessible. So thinking through more, what is it, something that I can accomplish even though I'm feeling this way? What's going to help me, get through my day? And maybe on those high stress burnout days, the thing that might make you feel better is like, I can wipe down my office, right? That's a task that I can do. It doesn't require a lot of thinking. It's something that I need to get done, that might make me feel better, but it's going to help. It's a task on my list I can check off, but it's not so overwhelming for me. So thinking just sort of like, what are, in this moment with how I'm feeling, what can I get done? Because I can tell you at the end of a day that was really overwhelming and stressful, like sitting down to document the 10 people you saw that day, is just going to add to that feeling. And so being able to prioritize and still move towards the work, but not continuing in that feeling. And then also thinking for yourself of things that might help, simple things, just deep breathing, clearing your head, going outside for some fresh air for a moment, little things that can help you center and reground in what you're doing. So just to sort of practice using the tool, we're actually going to take a quick poll here, and just take a moment and reflect in yourself in this moment. Where are you feeling yourself right now? Are you red? Are you overwhelmed? Are you burnt out? Are you in a green? Today's a productive day, or somewhere in between. There's a lot of people in the green today. That's good. So green and yellow, that's good. And really, I say that's good. That's sort of a judgment, which is wrong on how people are feeling. However you're feeling, whether or not you're green, yellow, or red, it is not bad or good. It is how you are in this moment. It's how you're being, and it's a reflection of the things that you have around you in your life. So thank you for sharing that with yourself. And we're going to do a check-in again at the end, just to to see where we are following today's conversation. But, you know, really, as Lawanda said, there is no bad feeling. How you are feeling is how you are feeling. And I think trying to unattach sort of a judgment on that is really important, you know, and understanding and recognizing that if you're feeling burnt out or overwhelmed, you are not lesser than somebody who's not that day, because it's waves, and there are days where people may fall in that category, and recognizing that moment and that feeling is passing. And really, this is more of a tool to help ourselves, as opposed to saying, I've been burnt out for 5 days, like, why am I not as resilient as this next person? We're not talking about cultivating resilience today, because we're all resilient, having lived through this experience. So that's sort of our framework, our tool for today. And I think I'm going to pass it back to Courtney here.
So we are going to try something. We wanted to give folks the opportunity to share, but we know that not everyone feels comfortable speaking in a group. So we wanted to ask the question, what impacted your well-being over the past year? And that can, again, trying not to put a qualifier on it. That can be good, bad, that can be all kinds of things. That can be COVID, that can be family, that can be politics, that can be so many different things. So what we wanted to do is do a word cloud and make it interactive. So I put a link in the chat, and if you follow that chat, that link, it will bring you to a web page, and you can put as many words as you can think of that answers that question, and it will create a word cloud that I'm going to pull up and share my screen. And so we can just see what experiences are collective, and how much our experiences might be similar. And then that will help guide our conversation a little bit. So feel free to follow that. And as words come in, they'll start to come up on the screen. So we'll just spend a few minutes doing that and see what pops up for people. So politics, racism, unemployment, stress, support, new alliances, lockdown, family, immigration, childcare, school closings, loneliness, COVID, elections, Trump, unemployment, big one. The more people put the same words, the bigger those words get. Deaths in social circle. Canceled plans. George Floyd. Transition. Nature. Change of country. Tension with colleagues. Partner. Election. Zoom. Lots and lots of Zoom. Yeah. Imagine if we had done this exercise a year ago, how different this would be. You know, I think it's been a heavy year for all of us for so many different reasons. And when we see all of these words out in front of us, yeah, it's heavy. It's a lot. Lawanda, I'm going to hand it back over to you.
Yeah.
I'm going to stop sharing my screen. And for this portion I would welcome if those who ever feel comfortable of turning your cameras on, so we can get to see your faces as we try to open it up for a little bit of a conversation.
Yeah. You know, the words that you all listed and phrases sort of resonate with me. I laughed a bit at Mary's comment around Zoom, because I feel like my whole life is sort of dictated by Zoom these days, which actually has both, you know, pluses and minuses, I suppose. But I'd be curious to know. I saw so many different things coming up for folks, issues around unemployment and loneliness and politics. Um, I'd want to spend a little bit of time sort of opening up the floor as it were to see if people have things that they'd want to share about the impacts they've experienced.
I work at a homeless shelter, and with all of the closings and things that have happened just due to COVID, a lot of services have just been cut short or just are plain not, our clients aren't able to access them. And that has really played a huge role in my mental well-being, just feeling like I'm taking on a lot more from my clients than I ever have before.
Mhm. Mhm. Yeah, I will tell you, I think that, I don't want to speak for others, but I certainly, as a service provider, have felt that tension point. I think it raises this tension, I feel like, where it's very reasonable to some
Hey
extent
guys,
that
can I go on the other
places
side?
will want to sort of shut down and regroup because people are very afraid, and particularly early in the pandemic really didn't know what we were dealing with. But every decision like that has a consequence on the other side of it. And so, and that work still has to be done. So I can imagine quite a bit that would be very stressful, because that work does get shifted. And the clients, if they're out, and interacting with other agencies, if those agencies are not around or those services are not available, then that comes back to the folks who are still in it and doing the work. Um, and I would imagine that can be really challenging for a lot of reasons. I could sort of imagine this space where, this sort of, you know, dynamic around being grateful that we're there to be able to help. Perhaps resentfulness, about the fact that it's just us. And we've figured out a way to do this and other agencies have not. And I think holding space for the clients who aren't getting their needs met, can really weigh on people, I imagine. Yeah. Thank you for sharing that.
Sierra, I think to that point, I've been so frustrated and let down by our city's response, at a time where I feel like people should be getting much more creative and seeing how the need is just growing. To see people put more barriers in place or to continue to stigmatize people experiencing homelessness, it's so painful. We're so used to pushing against system problems to begin with. Like, that's just part of our DNA and what we do in advocacy, for our folks. But to see like the compounding challenges of like folks that are newly experiencing homelessness, really, really struggling, economic impacts, pandemic, and then to see our government, like our local governments, failing people in this moment, it just is driving me bananas. It's like this is when we need leaders. This is when we need bold solutions and not to continue to stigmatize. And yeah, it's driving me bananas personally.
Yeah, it's interesting you mentioned that, Courtney, because I can remember a situation very early in the pandemic where we were getting calls from clients about not being able to access food pantries. And what had started to happen in our continuum was that many of the food pantries, because of the fear of COVID-19, had converted to drive-by only food distribution. Now, on the surface, right? And I think this is one of the things with the pandemic, right? Like on the surface, it seems like, oh, we're making modifications to still get people access to food and to meet that need. Well, that meets a need for some, right? And to some extent, one of the things we see is that COVID has elevated all of the inequities that already exist within our system. Because in order to access a system like that, you actually had to have a car. And then you think about all the things it takes to be able to have a car, like money and insurance and gas and all of those things. And so it disproportionately left many of our clients unable to access those resources because of that. And so I think that was one of the things that sort of, when you, Courtney and Sierra, when you talk about service changes and delivery, that was one of the things that left me a bit frustrated. Yeah. What about others? Do others have things that have impacted them in meaningful ways during this time?
Yeah, I've been one of the folks that has been working remote this entire time, since March, been working remote. And it's on that other end, it just feels like such a struggle and I think a lot of us feel this way, of just like seeing all of the hurt and pain and suffering that's happening, and just feel like I'm watching it happen in front of me, and there's nothing I can do to help it. And also feeling a lot of kind of guilt for being safe and up here in my space, while other of my coworkers and colleagues are on the front lines and putting more at risk. And I think that similar feeling of feeling kind of helpless and like I am not out front enough is also compounded with the fights for racism and against white supremacy that are happening these days, and just feeling like we're still continuing in this fight in civil rights, where the white moderate is the problem, and that's my people, and feeling again like I'm sitting back and watching my friends and family and people who I love and respect be a part of the problem. And so just between racism and COVID, seeing a lot of parallels of just how I'm feeling helpless, but feeling like I need to do something.
Yeah. Yeah. And I think, to some extent, it goes back to this idea of moral injury, right? Like if your sort of core belief is to be helpful and to speak up in the face of things that are not just, not being able to actualize that can cause a very deep emotional wound. It feels very inconsistent with who you say you are at your core. I think someone mentioned the idea around creativity, and I think if no other time, this has been the time that we've had to be quite creative in terms of how we speak out, how we use our voice, even how we protest. But it has been a challenge to sort of see many of the things that have happened. I think in terms of what this pandemic has meant to clients and how it has compounded many of the inequities that people already were dealing with. But I think also witnessing some of the injustices that have been happening, even within our government, has been a challenge as well. How have you reconciled that for yourself, Catherine?
Well, trying to just, again, give myself permission to feel all these sorts of ways. So especially around the election time, allowing myself to feel all the negative feelings and not trying to kind of push past that or over sugarcoat it, but just really letting myself feel the sadness and the anger and the frustration of kind of like, yeah, I think Courtney and you have said it very well, of like seeing that just these existing inequities have deepened, and just the lack of awareness from so many people, when it looks like 73 million people wanted to vote again for a system of disenfranchisement. And so just letting myself really feel that anger and that frustration, and not trying to just move past it, because also trying to reconcile that we are a bit in a marathon rather than a short race, and that it's hard to deal with trauma once you're in the midst of it. And so just really trying to give myself permission to name the things that I'm experiencing and to feel the emotions that I'm experiencing, and giving myself grace to not be the best and do everything I used to do, and feeling less pressure or guilt around that. So feeling like it's okay to have less productive days, or it's okay to have lazy days and doing nothing, and then having other days where I can paint and be creative and have like an outlet for some of this energy. And reading, I would recommend for people just, I reread Trauma Stewardship, which is a great book that I read when I used to do trauma work, and just kind of reconnecting to resources and things that really help awaken my spirit, but doing that when I'm ready in the space to be doing that, and not really putting pressure on myself to feel like I always have to be thinking about positively coping through this time. But when I feel like I can, taking that on in ways that feel good to me.
Yeah. Yeah. You know, Susan David, who's she does therapy and has got some acclaim in terms of some of the ways in which she practices, but she has this expression, this quote, and it's she says, successfully experiencing, so you should endeavor to successfully experience your emotions as data, and not as directives. And that's something that I think about very often, is that when we have certain emotions, it really is this idea of noticing it as information, but I don't have to act on it, right? And I think for me, it's been helpful to think about that in terms of, the pandemic has created a situation where we don't really feel like we have a lot of agency. There are restrictions on our freedoms. And I would imagine that some people who already have feelings of restricted freedoms just because of the roles that we hold, in America, and under a system of white supremacy, certainly the freedoms that I can experience and the way that I can express that is going to look very different than how someone else might, as an African American woman who might meet some stereotypes, that exist in terms of, my skin color and my hair and all of these other like sort of phenotype things, right? And so there's already a sort of diminishment of one's at least sense of freedom. And then there's some other things in terms of COVID that also restricts my freedoms, and so in terms of being able to have agency to sort of go and be with people and do some of the other things I would want to do. And so that those things trigger emotions. And so experiencing those as data, as information, not directives by which I have to then act upon, has been helpful for me in terms of recognizing that I have some degree of agency. And that's something that's still intrinsic to me that has not been stolen by the pandemic, which has been nice. Yeah. Yeah. So thank you for sharing that. I see there's a couple of comments. I don't know if see what people are saying in the chat.
I think a major concept too is, and I don't know if it popped up in the word bubble, but the idea of grief and loss, during COVID times, which is difficult as it is, but I think, our ability to grieve and grieve collectively has been so impacted, and, individual grief and then also sort of collective grief. I don't know if we can sort of speak more on that, but I think that's an experience many folks have had in one way or another.
Mm-hmm. Yeah, absolutely. I almost feel like it's sort of, an asinine question to ask people, have they lost things or lost people that have been important to them during the pandemic? I'm wondering how people have sort of dealt with that, because I'm sure that there has been that has been something that people have experienced. If anyone would want to share.
Tom, did you want to share? I see your hand was up.
Well, thank you, Courtney. Can you hear me?
Yeah.
Mm-hmm.
Hi, everybody. My name is
Hi.
Tom. My name is Tom. I work for Greater Portland Health in Greater Portland, Maine. I'm a peer support specialist. I'm a person in long-term recovery of 36 years of continuous recovery from heroin and drugs and everything else I can put in my body. So I work in the recovery addiction end of Greater Portland Health as a peer. So this pandemic, along with everything else, and it's already been expressed about the election, all the other sidebars that are going on around the world, You know, I had to switch gears real early in the pandemic and look at my glass half full instead of half empty. And how I did that was I ended up going on to more groups within the world on Zoom, probably 3 or 4 a day, to keep my emotional recovery up. And look at it. In Portland, Maine, I'm out on the streets. I'm front. I'm boots on the ground kind of thing. And I would go into the parks with the homeless and speak with them because I was homeless in Los Angeles back in 1984. So I would go into the parks and on the street and talk to the homeless people and the marginalized population in the greater Portland area and just, you know, and do what I could do, give them resources. The agency I work for, we have walk-in clinics. So even though it was limited, I could still help them with resources of different resources within the city. So at the end of the day, with all, you know, the grief, I've had a lot of friends that overdosed and lost their lives through the pandemic and different things like that. So the grief, it's still a grieving process is a process. Okay. I don't think I'll ever erase the blackboard. Am I out of time?
No.
Oh, okay. No. It's someone in my household. So anyway, I lost my train of thought. So anyway, I just have to do the best I can with all the, like I said, all these sidebars going on in my life. It's once again, I have to live in the solution, not the mess. And, you know, there's a lot of messes in, especially the U.S. because I live in the U.S. And see the social injustice and this and that. I can let that take me down like a tidal wave if I want to. Okay. But I have to keep just at the little things to chip away, whether it's a city council, whether it's a community, and keep, or if it's a federal government, the state government, I have to keep doing my part to see if we can create changes. There's a long ways to go, but hope. Someone mentioned hope. That's one thing I do with my meditation and more is hope. Get up, lace your sneakers, get out there. And I call it shaking hands and kissing babies because we can't shake hands or hug anyone because of COVID, but just get out with my mask on and stay the distance and just try to bring hope to what we have to look forward to. Thank you for having me.
No, thank you, Tom, for sharing that. No, I think it's absolutely critical to think about how we focus on recovery and focus on the things that we do have control over. I think there can be a mountain of things that can make, like you said, feel like a tidal wave if you start thinking about all of the things that you don't have access to. And you know, it's really this idea of when you think about grief and loss, we often think about that in terms of like people. And people are critically important. You know, I always talk about this idea of community. And what I heard you talking about was ways that you've created a new community and ways to stay connected to your community, despite not being able to be with people physically. I think, and I, you know, if there's any public health people on the call, despite myself, I mean no offense, but I think there, in terms of public health, we could do a lot better with messaging. Because we talk a lot about, you know, having to be socially distanced, you know, social distance. And what I would contend is that we really just need to be physically distant. We don't need to be socially distant from people at all. I just need to not be in your face, but I can still have a very social relationship with you. And so I think, you know, figuring out ways to still stay connected, because I think people really do grieve. We are not born to be in a vacuum. We are not born to be of oneself, and we have not gotten here by our own doing. Someone in some place, in some way, has contributed to each and every one of us being here. And so we are a community of people and souls, right? And so we grieve that, I think, when we don't have access to it. We do grieve that when people aren't with us physically, but we also grieve that in the celebrations that we miss, and the occasions that we don't get to celebrate in ways that are customary. Even not being able to grieve someone's passing in ways that are culturally bound and appropriate can feel like another loss that's compounding the original loss, right? So I think that has done a lot. One thing I've encouraged or suggested for people to sort of think about, even with my own clients, and I think for myself as well, has been this idea that to not feel bad about grieving things that you have missed. I think oftentimes, especially if you think about it within the context of privilege, it's very easy to feel guilty or feel ashamed for like pining to see your family, or feeling guilty about the fact that you want to fly to see your family and you can't, or that you're missing a graduation or some other really important event, in your family. And so I think that it's okay to grieve those things, as privileged as they might be. Like both could be true. They could be very privileged things, and not and I'm grieving them. My husband is having a milestone birthday, and we had a lot of grand plans about what we were going to do, and we will not be able to do those things by any shape, form, or fashion. And really what that means, right? And it's not so much about the trip as it is a celebration of how many trips around the moon and what that means. And so I think it's okay to grieve those things that we had plans about and things that we hope for, that may not be able to materialize, and thinking of, and I think the releasing of that, like allowing yourself and giving yourself permission to grieve those things will then allow you to have the sort of brain space to think about how you create a new way of being, for the moment. Yeah, yeah. Are there other thoughts that people would like to share? Other things coming up for folks right now?
I thought the word cloud was really illuminating. And now that you're talking about grief, also, I had a friend who died of COVID. And what I wrote in the word cloud was school closings, because I just noticed that I don't even think I've been able to go there to really grieve. And because I'm just focused on getting through the daily stress. I've noticed I'm having a lot of dreams about my friend, and so it's definitely there and sort of unresolved, but I'm not quite able to address it yet, I think.
Mhm. Yeah, I think that's part of what happens, that we get very focused on surviving in the moment, and I think that's okay. Like daily survival is certainly very important. You have to get through this day before you could get to the next one, right? I got to pass through Friday before I could get to Saturday. So there's a lot of utility in that. But I think crises do create a situation where we're kind of navigating through life like moment to moment. And I think that there's some usefulness in that, to be quite honest. I think one of the things I think it's profoundly helpful to not think about things in terms of what I should be doing, or I should be grieving, or I should be doing this, or I should be doing that, but think about what it is. Like, and I don't think I've ever said it is what it is as much as I have during this time, and encourage people to sort of embrace that, because it really is what it is, right? And that's where you are in this moment. So I try to remove like shoulds and like ought to and all that kind of stuff out of my vocabulary as a practice. But yeah, it's really challenging. I think when you have the space to be able to process that, you will. And I think in the moment, you do what you need to do in the moment, to be okay in the moment. Yeah, but yeah. What are others thinking right now or experiencing?
Hi, it's Mary. I was just going to say that, I live alone, and had put up on the cloud isolation and how important it is for me to get out every day, and whether it's for a walk or a run, but and seeing people, seeing other people out, is energizing and uplifting. Is just a very helpful tool for me. It just makes a big difference, and it's just been really, really helpful. That's all. And I do it every day. So.
Well, thank you for sharing that. You know, finding ways to stay connected to things that have meaning for you.
Mhm.
And it's sort of why, like what you spoke about, Mary, it's sort of dawning on me now. Like I think that's one of the things that why I've sort of moved away from this idea of like self-care, because it really is just like doing the things that make you feel like good and purposeful and all of that.
Mhm.
And if being out and staying connected, it's little things, right?
Mhm.
That I think can help us sort of navigate through this time.
Yeah.
The idea, I can remember someone talking to me about, like yoga and how it's so great, and, it's great for self-care. You just need to do some yoga, just do some yoga, just do some yoga. It's like, I don't like being on the floor. That's not a relaxing thought to me at all. And so, really thinking about like what actually helps me feel well,
Right.
and feel my bbest self. And I think like for me, if I can't get outside and feel air on my skin,
Mhm.
yeah, my day it's off. And so I spend a lot of time like in between things like this or meetings, particularly when I'm at home. I just go to my front door and just get some fresh air and then just come back inside like two seconds.
Yeah.
And it really is a nice reset for me because it's something that I enjoy. I enjoy the outdoors, and it's very helpful. So I think thinking about things that are just in line with like who you are, and
Mhm.
thinking about how you not I like to think about it in the idea of not letting COVID steal my joys, um, and so operating out of that. But yeah, I'm glad that you have found things to still help you feel good during this time.
Yeah.
What about others? What other things have people done that have helped them sort of sustain?
The other thing I was just going to say is being of service to others. I think a lot of people have done this, like pay it forward or that expression, but it seems like a lot more people, and I've tried to do this as well, whether it's just writing a card to someone or um, buying a coffee for someone, or just doing helping your neighbor next door, or just being more cognizant of doing. People just seem to be more aware of helping others during this time, and bringing a meal to someone, or and I think because people, we don't, it's like, how do we help? What can we do during this time? And it's those little things that just give us a lift in our day when we, sometimes I just feel helpless, what can we do? And I do like thinking about other people. It gets me out of my head instead of thinking about me all the time.
Mhm. Mhm. Yeah. And I would imagine showing up even, big ways and small ways, are tremendously helpful to people.
Mhm.
Yeah. I mean, it's really interesting to think about how the things that we do, how the impact that it leaves on people, it might seem very small to us, and can be really life changing for other people. I imagine.
Sure. Yeah.
Yeah. Yeah. And really thinking about I think how we show up in community for one another, and and really taking opportunities, I think, to talk to people and let people know exactly what they mean to us.
Mhm.
Um, you know, um, you know, Oftentimes when we want to be with people, it's for a reason, right? And so you might not be able to be with someone in the same way, but you certainly can share with them why you want to be with them so much, right? And I would imagine that could have just the same impact as you being there physically. For someone to know that you care about them and that they mean so much to you, um, I imagine could be just as helpful. Yeah. Yeah. Right. Any other thoughts or things people would like to share?
Wanda, I don't remember what the prompt is specifically. If we're just sharing how we're coping.
What's impacted?
Yeah, I was late to this because my kids are home from school. I'm the primary caregiver. Had to make their lunch at the same time. They're right there. I have nowhere to go in my house to be away from them, and they're driving me crazy. I saw a tweet the other day that was really amusing to me that said, I'm getting real tired of babysitting my mom's grandkids. And that's how I feel. And what you said before resonated with me, that it's both and, that I at once am having a hard time and I benefit from all the privileges. So just holding both of those in tension. But how I'm coping is that I'm just lowering my expectations. I'm just not going to be as productive an employee. My boss is not on the call, I don't think. There will be days that I'm not working 7.5 hours, and that's okay. I've given myself the grace and try to be as productive in less time. And I don't know what else to do.
Yeah. I will say, it's funny you say that, Michael. So I do have a couple of employees on the call. And I will say, I feel very similarly to you. I recognize that you all might not have as productive of days. I hope that people will give themselves the license to do that and operationalize that as well, right? Because I think sometimes it's, we have expectations of ourselves too. Because I think, the HCH community, we're full of like ambitious people. Like we are absolutely going to save the world and do our part, right? And show up. And so we are very ambitious. And I think we oftentimes have really high standards of ourselves. And it's not to say that we shouldn't, but I think we also need to be cognizant of where our limitations are, and be responsive to what's going on around us. And to know that to think that someone is going to be at 100% every single moment, every single day, given all of this crap that's going on around us, that's a really unrealistic expectation, for us to have of others and for us to have of ourselves too. It's really an unkind thing. So I'm glad that you said that actually, because I think that's really helpful for people to hear, and it's okay. And there's no judgment in that for sure. Yeah, yeah, yeah. I can relate to having kids around. My kids are not little, um, but and sometimes when I say like I'm tired of being around them, I have to whisper because they're big people and they can hear and they hear well. but I love them dearly. But yeah, it's definitely both and.
Lawanda, I wish we could just bottle up how you just affirmed that for all of us and send it out to the whole HCH community.
Yes.
We all need to give ourselves the permission and
Yes.
do it for each other as well.
Some days it's just a matter of like, what's the least I can do? Like I look at my to-do list and say, okay, what's the low-hanging fruit here? You know, and I save the other things, you know, you prioritize, but certainly there's days that it's a low-hanging fruit kind of day. Yeah. All right. Well, we are coming up at 2 o'clock. It might be a good time to sort of, I know that we want to do some checking in, right? Courtney and Caitlin.
Yeah. So I think Courtney is going to launch another poll here. And so just giving yourself a time to check in with yourself. And again, not in a place of judgment, but reflecting on, you know, having these conversations, connecting with others. It could be energizing for you. It maybe could have been draining. Maybe it was neutral, but just sort of seeing where you are in response to this conversation and recognizing you're likely transitioning back to that work day, it being a Friday afternoon, you know, where am I and what do I need to do for myself, and pivoting from this conversation back to sort of the things that are going on in my day, with managing children, which can definitely relate to, or a work day, or both, which many of us are doing right now. Great. Well, some greens and some yellows, and again, I'm glad to see no one is in red more, just because, you know, that doesn't feel particularly good. But if you are there and you were there, you know, that's just where we are today, and recognizing that. So I encourage you, we'll send out this tool we have as a handout. We'll share that after this webinar today. Here are just a couple of resources listed that may be helpful. I know several folks mentioned therapy, art therapy, music therapy in the chat here. These are a couple of other resources that are available for frontline workers. The Emotional PPE Project is a mental health resource for people who are working in the front lines at no cost, no insurance requirements. And in the other case, you know, someone mentioned helping others can be energizing. Perhaps if this is your profession and you wanted to donate time, they are looking for volunteers as well. So from either end, it's a great resource. And the National Alliance on Mental Illness also has resources for frontline providers, including peer support groups, and can be a really great resource for those that might need it. And then plugging our next coffee chat, Catherine just shared the link in the chat for those who are interested in joining. We welcome everyone to join. Matt Bennett is going to be coming with us and talking about moral injury and burnout, and sort of the what's next, or what can you do, furthering this conversation along. So we really appreciate everyone here coming and joining us authentically, listening in, supporting each other, bringing a sense of community. I think that we are all seeking these days. So we're very appreciative of you and thankful for you.
And I think I need to put a link for the review, I think. Yes, I would be remiss, Brandon, if I did not. I promise to include it. So if you could just take a minute, we have a quick Survey Monkey, and just give us some feedback so we can always continue to improve our work. But thank you so much for participating and coming and sharing. We really appreciate all of you. So have a wonderful weekend, everyone.
Thank you,
Thanks,
everyone.
everyone.